Good afternoon. My name is Michael Pepe, Funeral Services Education student at Lake Washington Institute of Technology. And today I would like to share with you a little bit about Lyme disease. Lyme disease was officially identified in the northeastern United States during 1976. The disease lends its name to the geographical location where it was discovered. Many children who lived in Lyme, Connecticut during this time were thought to be suffering the effects of juvenile rheumatoid arthritis. Upon further investigation, it was discovered a tick-transmitted disease was the likely vector for Lyme disease. The same type of disease had been previously recorded in small numbers in parts of Europe and America. Little was known about the cause of Lyme disease during this time, and the mystery would continue to elude scientists for another 5 years. Willy Bergdorfer, Ph.D., and his colleagues discovered the spirochetal bacterium responsible for Lyme disease in 1981. It was concluded that Lyme disease is caused by the spirochetal bacterium called Borrelia burgdorferi, which is found in the nymph of the Ixodes scapularis or black-legged tick. In order to prove that Borrelia burgdorferi was the true cause of the disease, Bergdorfer cultured the organisms in patients who were in the early stages of the disease. The patient's immune responses to the organism proved the spirochetal bacterium Borrelia burgdorferi was the cause of the disease. Since then, genotyping has further subdivided Borrelia burgdorferi into 11 different genospecies divided by pathogen, geographic location, and vector. According to Johnson, 1993, the mechanism by which Borrelia caused Lyme disease has not been elucidated. Early Lyme disease is characterized by an expanding annular red rash, erythema migrans in approximately 7% of the patients, which is frequently accompanied by fever, fatigue, headache, and muscle and joint pain. Arthritis, neuritis, and carditis may also be present during early Lyme disease. Persistent neurological and arthritic infections lasting for months to years may occur in some patients. It is important to note that 30% of patients in the early stages of the disease will not develop the annular expanding red rash, which makes the disease more difficult to diagnose. The difficulties of diagnosing Lyme disease has caused many people infected with the disease to live with the symptoms for many years. A recent article titled "When Lyme Disease Lasts and Lasts" states, "Chronic Lyme disease is a highly controversial catch-all term for a host of long-lasting symptoms that may or may not stem from prior infection with the bacterium that causes acute Lyme disease. Often misdiagnosed and mistreated, chronic Lyme disease leaves thousands of people physically and mentally debilitated and without medically established recourse." In one case, a 54-year-old female had experienced headaches, aching joints, fatigue, and vision problems for 10 years. She was given a number of tests including the Western blot test and the enzyme-linked immunosorbent assay, ELISA. The test she was given came back negative for Lyme disease, and she was diagnosed instead with multiple sclerosis by her doctor. After suffering from high temperatures and flu-like symptoms on a daily basis, she decided to consult a specialist. The specialist confirmed that she was not suffering from the effects of multiple sclerosis, but Lyme disease instead. As we can see, the symptoms of Lyme disease often mimic the symptoms of many other diseases, which can make the disease quite difficult to diagnose. Treating Lyme disease depends on whether or not the disease is in the early stage or the late stage. The chances for a full recovery during the early stages of the disease are good if treated with oral and intravenous antibiotics. According to the Mayo Clinic 2015, these are the standard treatment for early stage Lyme disease. These usually include doxycycline for adults and children older than 8, or amoxicillin or cefrizine for adults, younger children, and pregnant or breastfeeding women. A 14 to 21 day course of antibiotics is usually recommended, but some studies suggest that a course lasting 10 to 14 days are equally effective. Once Lyme disease becomes chronic, the only recourse is to treat the symptoms of the disease. Many of the late-stage symptoms are the same as the early-stage Lyme disease, but continue to linger on for the rest of the patient's life. According to Georgi 2015, treatment for chronic Lyme disease is often focused on reducing pain and discomfort caused by symptoms. Prescription or over-the-counter pain relievers may be used to treat joint pain. Non-steroidal anti-inflammatory medications, NSAIDs, and intra-articular steroids can be used to treat problems such as joint swelling. According to the Centers for Disease Control and Prevention 2015, there is no evidence that Lyme disease is transmitted from person to person. A person cannot be infected from touching, kissing, or having sex with a person who has Lyme disease. However, it is important to note that the bacterium Borrelia burgdorferi can live in the blood of people who have not been treated for the disease. It is recommended that people who are undergoing antibiotic treatment for Lyme disease should not donate blood. Only after completion of antibiotic treatment can a person's blood be considered for donation. A recent article by Steve Jacobs titled Lyme Disease states, although in theory Lyme disease could spread through blood transfusions or other contact with infected blood or urine, no such transmission has been documented. There is no evidence that a person can get Lyme disease from the air, food, or water, from sexual contact, or directly from wild or domestic animals. There is no convincing evidence that insects such as mosquitoes, flies, or fleas can transmit Lyme disease. On the contrary, recent investigative studies point to Lyme disease being spread through sexual contact and mother to fetus. A study was presented at the annual Western Regional Meeting of the American Federation for Medical Research. The study in the Journal of Investigative Medicine 2014 divided the participants into groups: a control group that did not have Lyme disease, a random group of men and women who did have it, and a group of married heterosexual couples who had Lyme disease and engaged in unprotected sex. They then tested vaginal secretions and semen samples and found that the control group did not have the bacteria in their vaginal secretions or semen. All of the women who had Lyme disease had the bacteria present in their vaginal secretions, and almost half of the men with the Lyme disease in the study showed the bacteria in their semen. According to a recent Fox News report titled, Can Lyme Disease Be Spread Through Sex? Sometimes Lyme strikes multiple members of the same family, the parents and the children. Some of those families believe the bacterium that causes the debilitating symptom of Lyme disease can also be spread through sexual contact. Others believe Lyme disease can be transmitted to children during mother's pregnancy. The Fox News report highlights families where the mothers, fathers, and offspring all have the disease. Currently, the CDC has not yet substantiated any claims that Lyme disease is transmitted through sexual contact or pregnancy. Please watch the video on the next slide. Keeping this in mind, the bacteria Borrelia burgdorferi should be treated no different from any other bacteria we may encounter in the prep room. The embalmer should always practice universal precautions, engineering controls, and work practice controls in order to protect them from any possible exposure. According to Mayer 2012, the basic premise of universal precautions for the embalmer is to treat all human remains as if they were infected with HIV, HBV, or other pathogens. In other words, the embalmer should treat all bodies with the same caution that would be applied for extremely hazardous, potentially fatal infections. One of the problems that may arise from the embalming of the remains of a person infected with Lyme disease is generalized edema. The edema is caused by the swelling of the joints from Lyme disease arthritis. The embalmer must use a hypertonic arterial solution in order to draw out the fluid from the generalized edema. The use of specialized high-index arterial fluids is recommended to dry and preserve the tissues with edema. The embalmer can also incorporate the use of a dehydrating co-injection chemicals with arterial solutions in order to draw out the moisture. There are some general techniques for the treatment of edema during embalming which the embalmer must consider. The use of sexual injection allows the embalmer to control the strength of the fluid and direct it to the endemic areas of the body. The use of interrupted injection is another way the embalmer can ensure proper diffusion of arterial solution. The use of interrupted injection allows time for the edema to be drawn from the tissues and directed into the circulatory system for drainage. Other techniques include the use of direct hypodermic injection, elevation, gravitation, channeling, wicking, lancing, draining, and the use of plastic protective garments along with absorbent powders. As we have learned, the spirochetal bacterium called Borrelia burgdorferi causes Lyme disease in humans and animals. We understand the tick vector in which the bacterium is transmitted and the symptoms associated with the disease. We know the disease is curable during the early stages with the use of antibiotics and untreatable during the late stages. However, there is still much debate regarding the transmission of the disease from person to person. Regardless of whether or not further research proves that Lyme disease is transmitted from person to person, embalmers should always take universal precautions. With over 300,000 cases of Lyme disease reported by the CDC last year, is it worth the risk not to take precautions? Thank you.